So hello guys, welcome back to new video of Medico YouTube channel. So myself Akash. So I think you have already saw ECG basics and how to read ECG part 1. Okay, and now you are here to see the remaining 7 points of ECG. In previous video I have explained rate, rhythm and the cardiac axis. Okay, now we will see the remaining 7 points of the ECG. By that you can read ECG completely very easily. Okay, so without wasting any time, let's start the video. So okay guys, ECG is also known as EKG. Okay, this is the third part and we are going to see the remaining 7 points, and it's taking a lot of effort to make this presentation. So stay focused with 100% of your focus. Okay, stay focused until the end. Okay, we have already saw rate, rhythm and cardiac axis, and now we are going to see the remaining 10 points, that is P wave, PR interval, Q wave, QRS complex, ST segment, T wave, QT interval. Okay, first you should know the basics, then only you can understand each and everything. Remember these 10 points also, like how to read, you can get them. Okay, starting with the P wave. Okay, P wave, this P wave consists of P wave. What does P wave indicate? P wave indicate the atrial depolarization. Okay, and it is of 2.5 to 3 small squares. P wave consists of 2.5 to 3 small squares, and the time for P wave is less than 120 millisecond. Okay, then all the leads of P wave are upright. Okay, except AVR and V1 lead. In AVR you can see inverted P wave, and in V1 lead you can see biphasic P wave. Let me show you. See, there are totally lead 1, lead 2, lead 3, AVR, AVL, AVF, V1, 2, 3, 4, 5, 6. In every graph there is P wave is upright. Okay, P wave is upright, but in AVR the P wave is inverted. Let me show you. You can see the P wave is inverted here, and in V1 the P wave is biphasic. Okay, like this, biphasic. You can see biphasic. Okay, the P wave is biphasic in V1. These are the 2 points you should know. Now back. Duration of the P wave is greater than 3 small square. It signifies left atrial enlargement. If the height of the P wave is less than 2.5 small squares, it signifies right atrial enlargement. So please kindly make note of this. Okay, these are things you should understand by yourself. In AVR there is inverted P wave, and in V1 there is biphasic P wave. P wave denotes atrial depolarization. Now coming to the PR interval. PR interval is of 3 to 5 small squares, and the duration is 120 to 200 milliseconds. What does PR interval indicate? PR interval after the atrial depolarization and before the ventricular depolarization, there is some time gap. That is PR interval. Okay, it is of 120 to 200 milliseconds. If the PR interval is short, that is less than 3 small squares or less than 120 millisecond, it denotes Wolff-Parkinson-White syndrome or Lon-Ganong-Levin syndrome or any other disease conditions. And if the PR interval is prolonged, that is greater than 200 millisecond or greater than 5 small squares, it indicates first degree heart block or Morbid's type 1 heart block or complete heart block. Okay, let me show you. See, this is Wolff-Parkinson-White syndrome. This is seen in V5 and V6. Okay, there is formation of delta waves. You can see. Let me show you. See, a normal ECG will be like, see, P wave, QRS interval, then T wave. There should be duration between PR interval. This is PR interval. Now you can see after the P wave there is no PR interval. Directly there is formation of QRS complex. Okay, there is no space here. There is no PR interval. PR interval is shortened in Wolff-Parkinson-White syndrome. Okay, Wolff-Parkinson-White syndrome. Now coming to the prolonged PR interval. Prolonged PR interval means the PR interval has been increased. Okay, it is seen in first degree heart block. Let me show you. See, here you can see after the formation of the P wave and the next QRS complex, there is a prolongation of the PR interval. Okay, that is greater than 200 millisecond. That is happened everywhere. See, here and here. Okay, this is seen in first degree heart block. Wolff-Parkinson-White syndrome, there is decrease in the PR interval. In first degree heart block, there is prolonged PR interval. The other things are like basic things. Try to take screenshot of this picture. Okay, it is very important, and explain 4 things at a time. Next, coming to the Q wave. Q wave. Okay, QRS complex. Q wave is a part of a QRS complex. It is due to the ventricular septal depolarization. And QRS complex significance is when there is pathological Q wave. When is pathological Q wave? When it is greater than 2 mm depth and greater than 1 mm wide. When the Q wave is greater than 2 mm depth and 1 mm wide, it is seen in V1 and V3 of the graphs. Okay, Usually it indicate current or prior myocardial infarction. These are like facts things, okay. There is no much like you need to remember. Just make a note of it so that you can remember and revise it. So when is a pathological Q wave, you can see that the Q wave is deepened greater than 2 mm deep and it is 1 mm wide. See, the size of one small square is 1 mm, okay. As it is crossing more than 2 squares here, then it denotes greater than 2 mm, and the length is greater than 1 mm, okay. Because as it is taking more than one small square to cross, therefore it is greater than 1 mm. Pathological Q wave is when greater than 2 mm deep and greater than 1 mm wide. It indicates current or prior myocardial infarction. Q wave significance. Next. Now let's revise rate and rhythm. For rate and rhythm, we will see rhythm strip. What is rhythm strip? It is a lead 2. That is given extra downside, okay. Next, for cardiac axis calculation, we will see lead 1 and AVF. We saw no, like we will subtract R minus F, where R is height and S is the depth of the QRS complex, and we will plot a graph of it, and we can determine like a normal axis, right RAD, LAD and EAD, okay. For P wave and PR interval, we will check lead 2, and for Q wave we will check V1, V2 and V3, okay. Next, coming to the QRS complex. QRS complex, it is one of the most important thing. And what does QRS complex indicate? It indicate ventricular depolarization, and it consists of 2 to 2.5 small squares, and time is 80 to 100 milliseconds. Okay, it is very fast, rapid, 80 to 100 milliseconds, and 2 to 2.5 small squares. What now the significance of QRS complex? If the QRS complex is narrow, means narrowed, then it both indicates tachycardia. If narrowed or widened, both indicates tachycardia. But if it is narrowed, it is because of supraventricular tachycardia, means because of atria, okay, atrial fibrillation and atrial flutter. Supraventricular above the ventricles type, because of atrial fibrillation and atrial flutter. Next, coming to the widening of the QRS complex, means the duration is widened and the number of square covered is also widened. That indicates tachycardia. It is because of ventricular tachycardia or Torsades de Pointis. Okay, if QRS complex is widened, it is because of ventricle. If it is narrowed, it is because of atria. Here you can see it is narrowed and here it is widened. So the diagram which is shown here, you can see the V1 to V6 lies in a horizontal plane, and AVR, AVL, AVF and lead 1, 2, 3 lies in a vertical plane. So in ECG basics, I have already said like AVR, augmented leads and limb leads find the electrical activity of the heart in a vertical plane, and the chest leads finds electrical activity of the heart in a horizontal plane. This is QRS complex. Okay, this is the normal QRS complex. Okay, there is nothing much. You should remember, like if it is narrowed, it is because of atria. If it is widened, it is because of ventricles. Now we are coming to the ST segment. Okay, ST segment is one of the important thing. Okay, if there is ST segment elevation, it is because of myocardial infarction, pericarditis or hyperkalemia. Okay, if in myocardial infarction there is formation of convex ST segment, and in pericarditis there is concave, and hyperkalemia there is increase in K plus. And depression is because of hypokalemia, decrease in K plus concentration, and chronic stable angina, ST segment. Okay, most commonly ST segment elevation is seen in myocardial infarction. Okay, that this is the one point you should remember: ST segment elevation in myocardial infarction. So based on leads in which the ST segment is elevated, means there will be graphs, no? AVR, AVL, AVF, V1, V2, V3, V4, V5, V6. In which graphs the ST segment is elevated, that by that we can identify which side of the heart is myocardial infarction is there. It means infarction is there. Okay. If the ST segment elevation is seen in lead 2, 3 and AVF, there is inferior wall myocardial infarction. If it is seen in lead 1, AVL, V5 and V6, then lateral wall myocardial infarction. If it is seen in AVR, V1 and V2, then septal wall myocardial infarction. The most commonly V3 and V4 is seen in anterior wall myocardial infarction. V3 and V4 most common anterior wall myocardial infarction. Okay, because most commonly myocardial infarction occurs in anterior wall only. So you can see here, there is upside is a normal graph showing the ST segment elevation. Okay, and here downside you can see there is they have taken V3 and V4 graph, and in both the graph there is elevation of the ST segment. See, this indicates anterior wall myocardial infarction. Next, ST segment depression. Okay, There are three types of ST segment depression, that is upsloping, downsloping and horizontal. Okay, this is ST segment depression. The ST segment depresses below the isoelectric baseline. Now coming to the T wave. Okay, what does T wave indicates? T wave indicates ventricular repolarization, means ventricles are relaxing now. The height of a T wave is less than 5 mm in limb leads and in less than 10 mm in chest leads. Okay, chest leads are V1, V2, V3, V4, V5, V6. Limb leads are L1, L2 and L3. T waves are commonly of three types, that is hyperacute T wave, which is seen in myocardial infarction, that is seen in V5. Okay, and tall tented T wave, it is seen in hyperkalemia, increase in K plus concentration. That graph we should see V5. Okay, now T wave inversion, there is inversion of T wave, it is because of hypokalemia, decrease in K plus concentration, and other condition is myocardial infarction. In both ST segment elevation and non-ST segment elevation myocardial infarction, you know, like STEMI, STEMI. Okay, ST segment elevation myocardial infarction. See, I have combined two pictures here. In hypokalemia, you can see there is T wave inversion, ST segment depression and prominent of the U wave. Okay, and in hyperkalemia, you can see they have pulled up the T wave, peaked T wave and P wave flattening. There is P wave is flattened and prolonged PR interval and wide QRS complex. And you can see there is hyperacute T wave. Okay, that the length height of T wave is increased. You can see height peaked sharp symmetrical T wave. Okay, these are the three conditions. You can see T wave. Take a screenshot of it and try to remember again and again. Okay, remember hyperacute T wave, tall tented T wave and T wave inversion. Okay, now coming to the QT interval. Okay, for QT interval, one more thing. See, P wave, QRS complex, T wave. Okay, from where the QT interval starts? QT interval starts at this point. Okay, here. From here to until here, it includes both ventricular depolarization and ventricular repolarization. Okay, this is QT interval. It has written QT interval includes both ventricular depolarization and ventricular repolarization. Let me zoom. Okay, the normal duration of QT interval is 9 to 11 small squares, and that is a time limit is 360 to 400 milliseconds. One important thing you should remember is QT is inversely proportional to the calcium. If calcium concentration increases, the QT interval decreases. If the calcium concentration decreases, the QT interval increases. You can see here, QT interval is prolonged, means QT is increased, then calcium should decrease. Calcium is decreased in conditions like tetany. Okay, if QT interval is narrowed, QT interval decreased, then the calcium is increased. The conditions where the calcium is increased are vitamin D intoxication, parathyroid adenoma and carcinoma of the breast. Okay, remember these things. These are like facts. Okay, not facts, but some concept is there, you should remember. See, there is prolongation of the QT interval. You can see the normal, already the graph length has been increased. See, this is the normal thing. Extra part is this much. This is the extra part which shows QT interval is prolonged. Okay, by this I have covered the remaining all the 7 points. Please show support. Okay, it is taking a lot of effort to make the PPT and to gather all the pictures and combine them. Okay, and all the sources from Google. And if you have any issues, you can DM me at my Telegram or Instagram handle. Okay, you can see this is my Medico memes 12345. It is my Instagram handle, and at Medico Man India. Please follow the page in the Telegram. Okay, you will get notes and everything. These are the main 10 points. Let's revise one time. Rhythm, rate, cardiac axis, P wave, PR interval, Q wave, QRS complex, ST segment, T wave and QT interval. Once you hold the ECG, you need to see all these points one by one and try to take a ECG paper, and while seeing my video, try to mark out the segments, like I need to see this and this, I need to see this and this. Then only you can come to know like how we should really use. This is I am teaching something like theory. Okay, and I have taken the ideal pictures and I have explained. But when you hold the ECG, it will not as same as you are seeing this video. It's look very much easy while seeing this. We need to see like this much only. But it is not so much easy. Okay, once you hold the ECG, your mind will be fully blank. I have experienced this, but we should practice it again and again. One day we can do it finally. Okay, all the best. Even I am learning. You should also learn. Bye bye. Take care. Jai Hind. Jai Bharat.